mynews.studio.
A twice-yearly HIV prevention shot is landing in Africa before it arrives on Wall Street. Could this change the fight against AIDS?
Today's date is July 10th, 2025. So this is a single injection every 6 months. That's what Lenacapavir offers, right?
That's right. What's really notable is that, for the first time, this drug is launching in low- and middle-income countries at the same time as wealthier nations. Usually there's a gap of several years before that happens.
How did this come about? Was it just a matter of regulators moving faster, or was there some kind of deal involved?
It was a negotiated agreement. The Global Fund and Gilead Sciences made a deal. Lenacapavir will be provided at no profit in eligible countries until generics become available. This could mean up to 2 million people get access over the next 3 years. First shipments are expected in Africa by the end of this year.
Why is this such a big deal for people living with or at risk of HIV in these countries?
Daily oral PrEP does work, but it's tough for many to stick with it. There's stigma, daily routines, and access issues, especially for adolescent girls and young women in sub-Saharan Africa who are most at risk. Lenacapavir is different. Just one shot every 6 months. It's discreet and much easier to keep up with.
And what about efficacy? Are we looking at a small improvement, or is it more significant?
Phase 3 clinical trials showed more than 99.9% of participants stayed HIV negative. The World Health Organization is expected to recommend it this month.
So then, access is the main challenge. How will this actually be rolled out in these settings?
Countries will be prioritized based on their HIV rates and national prevention plans. The places with the highest incidence go first. Delivery will depend a lot on community leaders, mobile clinics, and working through existing health systems, not just hospitals.
And the money? Is the Global Fund paying for everything?
The Global Fund is covering most of the costs for countries it supports, but ongoing government and donor investment is essential to scale up. The goal is 2 million people, but the actual need is much higher.
You mentioned controversy earlier. Not everyone is included?
That's correct. A lot of Latin American countries are excluded from this deal, and from Gilead's generic licensing too. Advocacy groups are saying this is a missed opportunity, arguing that patent barriers and profit motives are leaving millions without access.
So what options do those countries have? Is there any policy action they can take?
Some are looking at compulsory licensing or challenging patents, legal steps to let them produce or import generics without the patent holder's consent. Regional cooperation might help as well, but it's complicated and takes time.
Does this set a precedent for other medicines in the future?
It does. This is the first time we've seen a global launch like this, with no profit pricing for HIV prevention. If it succeeds, it could be a model for other drugs and vaccines. It's also a test whether health systems and policy can keep up with the pace of science.
So the main takeaway, is this about the science or about the systems that deliver it?
It's both. The science gave us Lenacapavir, but who actually benefits comes down to political will, funding, flexible policy, and breaking through patent barriers. It's a moment where everyone is watching to see if this model can be repeated.
One last thing. What makes this moment stand out from other HIV breakthroughs?
For the first time, the newest tool for HIV prevention isn't launching in New York or London. It's starting in the communities with the greatest need. The real question now is whether access will match the promise.
That's the story. A twice-yearly shot, a new model for access, but still a long way to go.
Thank you for joining us. We've explored how Lenacapavir could change HIV prevention, the challenge of fair access, and the ongoing policy debates.
And as always, the real test is whether innovation reaches those who actually need it. Thanks for listening. This episode was powered by mynews.studio. Try it now for free.